Next, Representative Backer. As he makes his way forward, Representative Backer moves that House File 973 be laid over for possible inclusion. Welcome, Representative Backer. Whenever you're ready, please present your bill.
Sure, thank you, Chair and members. House File 973, first of all 87 counties and 4 tribes are covered by mobile mental health crisis teams. These teams were developed to have a high mental crisis resources instead of calling police or EMS during their time of crisis, because obviously during the time of crisis you want to make sure you get the right service instead of someone who has best intentions. And unfortunately I've been on a few of those runs in which we have had mental crisis and have learned a lot of stuff. So that's why this is something that's important to me. While some services provided by crisis teams can be charged to medical assistance and Medicare, it is rare to provide for private insurance to cover the same services. The grant money provided by the legislative was to ensure access to services for all Minnesotans, which in 2023 was a one-time appropriation of $8 million. So what we need is the teams operating, and they did that so teams could operate 24/7 instead of, again, when there's in situation calling police, and sometimes they'll even call fire or EMS. And we need that readiness, just like we've been having the discussion in health about readiness for EMS. We need that readiness for mental health whenever help is needed, because if you have loved ones that need help, you want help now. Just like when we call fire, police, and ambulance. We don't want to, and at the same time, we don't want to charge the folks for calling for services because we want to help them during their time of crisis. Last year, we learned in a Fox 9 report that Ramsey County was charging people for using crisis services, and we don't want a financial incentive to have people in crisis to call police or fire. Additionally, as I said before, in 2023, we put roughly $8 million into this program. Now, what does this bill do? This bill does a few things. It allows crisis teams to make sure they do not charge individuals for services provided. It also refers to the standards laid out by medical assistants. So we have a standard that we go by, a more tighter standard. Delete provisions reference to a number, like in our area, and I had to use it once on an ambulance run it was a Friday night run at 1, called our Region 4, and that was not a 988 number. That was a couple years ago, 2 years ago. So what this does is it puts the crisis teams numbers and insert 988, so we're driving them to one strong resource. It states that co-payments, coinsurance, and deductibles do not apply to crisis service under Minnesota Care, and it provides an opportunity for funding of crisis services. In your bill, it's blanked, but it would be, I would ask that it be $4 million each year for a total of $8 million in a biennium. And this also then allows to give people flexibility with those funds to help with a mobile vehicle and instead of transferring under NEMT. So with that, I have testifiers and one right now. One right now, not testifiers, just one.
Well, there's one that's remote.
There's going to be one remote, but one here. Okay, so go ahead, Sue.
Welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair. Member Sue Abderholden, Executive Director of NAMI Minnesota, a statewide advocacy organization dedicated to improving the lives of children and adults with mental illnesses and their families. And Minnesota has been trying to build a statewide mental health crisis system for over 20 years. The goal is to create a mental health response to a mental health crisis. When we do that, we decrease interactions with police and decrease the possibility that someone will end up in jail instead of in our mental health system. It has been funded by grant dollars, along with teams being able to bill Medicaid and Minnesota Care. Once in a great while, private insurance will pay. As was mentioned, Fox 9 had reported that Ramsey County was charging people for crisis services. I will note that they did finally change that policy, but we want to make sure that this doesn't happen in the future. And I want to just say that it wasn't just a copay for insurance, this was the entire cost of the service, and people were not expecting that. You know, we've advocated for crisis services from the beginning, and it was never contemplated that someone would be charged for the full cost of this service. It really does set up a financial incentive for people to use police instead of crisis teams. I will say we've had, you know, many police departments that have been hiring social workers, and I want to just note that this is different than that. These crisis teams have standards that they have to follow statewide, and they have to follow HIPAA. You know, they have to report data to the state, so this is a different system than just a police department hiring someone. And I just wanted to make sure that that was clear. We really want these mobile teams to be viewed as fire and police first responders, and we don't have people pay for those out of their pocket. And I will say that 988 has really increased the connection with our mobile crisis teams, because people are learning about 988, they're calling 988 instead of 911, and of course then they're getting a more appropriate response. I will say that the funding for these teams is far below what they need in order to meet the needs. The total statewide funding for our crisis teams is less than the City of St. Paul or Duluth Police Department. So they simply cannot respond in the same timeframes, but they are still extremely effective and can address many issues over the phone. And in the handout, I provided information from the state about the number of calls that they took and what the disposition was. The 2023 bill did provide one-time funding, which means the teams are kind of facing a funding cliff. Some of that money was taken back last year because it was not spent. And I will say sometimes it's hard for our system to use one-time funds, because you don't want to hire people and then have to let them go 2 years later. And so, you know, really putting things in the base, I think in the future also makes a lot of sense. So again, this bill prevents teams from charging people, removes any co-payments from Minnesota Care for these services, and provides an opportunity for additional funding, and for those funds to be used for something that we call protected transport services, which was developed several years ago as an alternative to someone being transported by police or by EMTs and ambulances. We only have about 3 vehicles in the state, and frankly, we need more, because especially in rural Minnesota, we want people to be transported with dignity, and we don't want to take those other vehicles, frankly, off of the streets in those communities. So thank you for the opportunity to testify.
Thank you, Ms. Abderholden. Next, through Zoom, we have Eric Sievers with the Hiawatha Valley Mental Health Center.
Good morning, Mr. Chair and members. I'm Eric Sievers, the Executive Director of Hiawatha Valley Mental Health Center. We are a community mental health center in southeastern Minnesota, serving 5 rural counties: Fillmore, Houston, Wabasha, Goodhue, and Winona. And I appreciate the opportunity to testify to support File 973. We're one of the many providers throughout the state. For over 10 years, we've been a provider of mobile crisis services in southeastern Minnesota. We are the only mobile mental health provider in this region, providing it 24/7. What we've seen over the last number of years is the numbers are growing with the implementation of 988 and with the additional state funding. What we saw in our area of the state is at the outset about 1,200 calls to the call center, which increased to around 9,000 last year. Our mobile response team in this year has seen a significant increase of assessments we've done. In the first 2 months of this year, we've more than equaled what we typically did in a quarter in the year prior. As the rate of suicide continues to rise, especially in rural Minnesota where we are, we know that this programming and our ability to meet the growing need works in part due to the various funding sources that are used to provide the service, including state grant funding. The state grant funding is doing exactly what it was intended to do for the community. It goes towards ensuring that we are able to have on-call mental health practitioners and professionals so that we can provide the best possible response time. Instead of using higher levels of care, which has been talked about, such as law enforcement, emergency room visits, we are able to provide more appropriate and better care with a mental health crisis team and focus on the crisis with the individual and their family to help manage that situation and stabilize them. This is not only providing those that live in Minnesota the best possible care, it's also the least costly form of care. So it is truly a win for all. What we can do with this bill is relieve the pressure on other parts of the system like law enforcement, jails, emergency departments. This funding removes barriers and helps support those without insurance or who have no insurance at all. Again, saving money for the state. The funding is not sustainable on billable services that we provide alone, which is why I ask that you please support stabilizing the funding for these critical cost-saving services provided in House File 973. Thank you, Representative Backer, for your work on this bill, and Mr. Chair and members for letting me testify today.
Thank you, Mr. Sievers, for your testimony. Is there anyone else who wishes to testify on House File 973? Seeing none, public testimony is closed. Questions for the bill author or his testifiers? Representative Keeler.
Thank you, Chair. I really appreciate this bill. I do know that a couple things, when you're in a mental health crisis, when you call 911, often, people show up with lights or sounds, which can really ignite a mental health crisis. And so I do think it's important that we have the right people respond. I think it's financially smart to do as well. I think it's crazy that we were charging people for this. And I guess I don't need to get into what Ramsey County was doing, but, any money that they recouped from charging people, were they able to give that money back to the individuals who were charged, or is that following them somewhere as a medical debt? Because I'm just thinking like unsheltered living, often medical debt starts the snowball to get individuals in trouble. Do you guys know where Ramsey County is at?
We do not.
Okay.
Representative Backer. Representative Keeler.
Thank you. So I appreciate that we're not going to do this at all in the state, because I think that's not humane. The one thing I do want to note that I really appreciate is not line 3.14 and the promotion of 988. It's, nobody really loves to talk about suicide, and the fact that when we don't have these ongoing mental health services in the community, it increases the likelihood that somebody's going to end up in a one-time crisis, that they need help. And so 988 is something that we've been working a lot on promoting. One of the things we did in the K-12 system is student IDs now in all of our schools. In the back of student IDs, the 988 number is there for our youth. We've been trying to get it in higher education. Can you tell me what your plan would be to promote this, or how we would promote this? Because we do want individuals to know that somebody's going to answer on the other line and be supportive.
Ms. Abderholden.
Thank you. Mr. Chair, Representative Keeler. 988, of course, is housed in the Department of Health, and so they have also been working to kind of raise awareness. We've even had actually, excuse me, some police departments on their police vehicles actually put 988 on there as a way to kind of remind people. We also have Travis's Law, which if someone does call 911, are supposed to refer someone. We loved being able to put it on the student IDs. We had done that voluntarily 2 years prior to that. Some districts, took us up on it, but not all. So I think if the crisis teams are making sure, there used to be a statewide number that wasn't 988 that didn't really work very well, but that's what's also mentioned in the statute, so we wanted to get rid of that and just focus on 988. I know that there are some additional things being done through the regional suicide kind of centers that are funded, but I will say there needs to be more, but it won't totally be covered here.
Representative Keeler.
Thank you, Chair. Yeah, I work with Department of Health really actually deeply with 988, because I do think we need to build out a robust thing. If anybody else wants to get on that train with us, we need people to really invest in that area. So I guess what I'm hearing you say is that in this bill, when you say promote 988, it's really just leaning into what 988 is doing already. There's no unique promotion styles or things that you guys have determined that you will do to promote in your lane specifically?
Correct.
Mr.
Chairman,
Ms.
Representative
Abderholden.
Keeler, correct.
And also, if I can comment too, we're creatures of habit. If we start, everybody's focusing now, when we got started, many years ago, 911 was not for EMS. Now, everybody knows it's 911 for EMS, ambulance, fire, and police, so a creature of habit, that's going to happen. So when we centralize it, more people will use it when they need it.
Mm-hmm. Representative Keeler.
Thank you. I think that this is an opportunity for members. We all have some sort of network within our community that people listen to us. And when we share out this information, suicide attempts is happening all over the state. It doesn't matter what community you're from. I think it's upon us sometimes to do this promotion part of what we have and what we're growing in the state. 988 is really wonderful. It has options to call if you're a veteran. It gives you those services, supports directly. And so I just really encourage all of us to utilize our own platforms to share in promoting what we're doing here with 988, just so our communities can be safe, and that our kids and our families know that we're creating nets to help them in the most crisis situation. Thank you.
Thank you, Representative Keeler. Representative Gander.
Thank you, Mr. Chair, and thanks for your testimony. Couple of questions. I'm learning about 988 on the fly right here, I have to confess. So this would be for suicide and also for other kinds of crises, is that right?
Yeah,
Representative Backer.
mental.
Yeah, mental crisis.
Yep,
So
that is correct.
If I'm
Because we want to make,
Yeah, yeah. Thank you,
we-
Mr. Chair.
Representative Gander.
So
go Representative.
if I'm schizophrenic and I sense that I'm in a bad place, you know, some kind of an acute event, I dial that number and I can get some help.
Representative Backer. Ms. Abderholden.
Yes.
Yes.
Representative Backer.
It's EMS, it's emergency help, and not just emergency, but it's obviously suicide, mental health crisis, and so forth. Just like we have medical crisis and we call 911 for that, or other type of, with fire, this is for mental health crisis. And we're working on giving those tools to help people who are thinking about suicide or other type of having a mental crisis.
Representative Gander.
Thank you, Mr. Chair. We're getting there. We're doing better now. So if I call this 988, and is there someone on that end that can triage that? And if I'm really in also another kind of medical emergency or need 911 services, are they linked to, say, my local dispatch to triage my call and dispatch, say, EMS or other first responders through the 988?
Representative
go
Backer.
ahead. You can
Ms. Abderholden.
Mr. Chairman, Representative, yes, so 988 is connected not only because we have call centers throughout the state, they can connect with the local police, fire, whatever that is they need. I will say, though, that the percentage is extremely low that they need to actually refer out. Even for some of the crisis teams, it's low because they really are able to engage with someone, help them kind of walk through what they're struggling with, and really resolve a lot of it, frankly, over the phone. It is pretty amazing what they can do.
And I would like to.
Representative Backer.
Yeah, thank you, Chair. And a lot of times it's just somebody to listen. And I don't use the word just as a meaning, it's minimum. Some of those simple things can do a whole lot, and that's really what it's doing, especially when someone's thinking about taking their lives.
Representative Gander.
Thank you, Mr. Chair. One last thought or question. Let's say we are in that emergency where there's a medical emergency and a mental health emergency. Do you find that you have good coordination on site, right? Do these teams coordinate pretty well together, or is that something else that we need to improve? Thank you.
I'll
Representative Backer.
I'll take that. From a practical perspective, with the times that I've been on scenes, everybody involved wants to help that patient. So yes, we do work well together, okay? Are we perfect? No, of course not. But our full intention is to help that. Generally speaking, if it's a medical emergency and requires airway, breathing, or circulation, we got to take care of those problems first because those are life-threatening. I'm not saying that the mental is not life-threatening, but those are immediate where then we can address that. So I've been on a scene for an hour and a half on a mental crisis. I've been on many of them, but this one in particular, an hour and a half. Myself, police, talking them down. We had a child involved, pets. It was quite a difficult situation, but we were able to solve that situation, and that was actually before this, that we had that. This would have been very helpful to have something like that. What we ended up doing was we separated the two parties. One went with the mom, grandma and the other one stayed home, and that's how we solved that crisis. But it would have been very much helpful to, because that was not an emergency, a medical help, it was a mental, it would have been nice to tap into it. And this gives us those resources, because this happened before 2023.
Representative Gander.
Thank you, Mr. Chair. That's all I have. Thanks.
Representative Corinne.
Thank you, Chair. And thank you, Representative Backer, for the bill and just for the recognition of how important it is to serve people who are in a mental health crisis. I really appreciate that we're highlighting 988 and those services today. Just want to jump on the team of saying 988 again in the microphone so people hear it. I do just want to address, there was the news story that you had mentioned out of Ramsey County. And I know that in that case, it was an uninsured resident who needed to access the service. And from what I hear from Ramsey County, afterward, they had community input and implemented a policy similar to what your bill is doing, saying that grant funds would be used for uninsured or underinsured folks, right? And I agree, like, nobody should have to pay out of pocket for anything like this. But, we also, in the context of human services spending and all of the things that entails, we have a lot of discussions about where the burden of those costs do lie. Because even though these services are really important, at the end of the day, they do cost money, right? And that's why we're here with this bill. And so I just want to make sure, too, that we're being mindful that even when counties are accessing grants to cover these expenses, they might only be getting 23 or 25% of those expenses covered. And so then that falls back on the county. And I'm not suggesting that we then pass that back on to residents who are using the service, but we all know that when a county continues to incur expenses without a revenue stream, that will end up upon all of the residents of the county at some point, right? And so I just wanted to sort of have that as part of this conversation, that I don't think any of us want to be personally charging people who are accessing this service, but we should be looking at how we're supporting counties so that these services are fully funded, so that then we're not just passing the buck on, because we really want to make sure folks are accessing this and not to a high expense. So just wanted to say that I do think this is a great idea. I don't think anyone should be paying for it. So I think it's a step in the right direction. I appreciate it.
Thank you, Representative Coran. Any response to that in particular, Representative Backer?
No, I'm, in this bill, yes, thank you, Chair. In this bill, we do have, I know it's ... but talk to nonpartisan staff, it would be 4 million. So our goal is not to pass the cost to the county and so forth, because this will save. This, number one, most important is to help the person in need. Okay. At the same time, it will also save money. Okay, because when you dial 911, that's the most expensive care, and you're not getting the best of care. Okay, we had a run many years ago that the person thought she thought she was George Washington, and that's not to be humorous about it. We just, I think 3-4 years on the service, we just didn't know how to handle it, okay? So we ended up doing a transfer, which round trip was 150 miles, extremely expensive, okay? So this will actually serve money, and then as we've heard, and I've also heard firsthand, that people get the help, we walk them off the ledge, okay? Because a crisis is a person's on a ledge, let's face it. They're on some type of a ledge, and they need someone to help them, so thank you.
Ms. Abderholden.
Thank you, Mr. Chair, Representative. I think the one thing to remember is that we are trying to create a statewide system so people know if I call 988 and I get a crisis team, this is exactly what will happen. And I understand there could be additional costs perhaps to the county, when state funds and grants don't cover everything. But we need to make sure that people know we know what happens when you call 911, right, in terms of you have a fire. We need to make sure that when people call 988, they know exactly what will happen and that they will not be charged.
Any follow-up, Representative Coran? Representative Noor.
Thank you, Mr. Chair. Thank you, Chair Becker, for bringing this bill forward, and Ms. Abderholden for really advocating for this, because mental health system was never built, so we're building on the fly as we go. Just quick question about the section for the grants. I don't know if Mr. Berg will be able to help us. What is the current funding for mobile crisis grant program?
Mr. Berg.
Mr. Chair, Representative Noor, my colleague, Mr. Harney, fed me a little data on this. I'm not sure about the base appropriation, but there is currently, it was 19 million was the appropriation in the current biennium.
Representative Noor.
Thank you. But also, I wanted to also separate the equipments and the vehicle, protected transportation, because I think sometimes we may get mixed up between the two, between the program and the need for having protected transport as the bill has been drafted. So hopefully, we can work together to really separate the two. Having the transport is really key especially for smaller counties who cannot afford to have those vehicles. So hopefully, we can work together and address it.
Thank you, Representative Noor. Representative Backer.
I have no comment on that. I would agree.
All right. Seeing no further questions from members, final word, Representative Backer.
Yeah, thank you. Ask for your support there, Chair, as we continue down the line.
All right. With that, House File 973 is laid over.